We're excited to announce that our podcast, The Table with Renee Da Silva, is evolving. We're introducing 3 new streams of content on this podcast, designed for Health System CXOs and hosted by the Health Management Academy's subject matter experts for health system nurse executives, health equity officers, and strategy executives. With this change, we'll be activating health system leaders towards outcomes and scalable solutions you can implement now. Welcome to the Health System CXO podcast, featuring 3 streams of content designed for health system nurse executives, health equity officers, and strategy executives. I'm Jasmaine McClain, Executive Director at the Health Management Academy and Health Equity Officers host. And together, we'll explore equity in plain language and assist you as you navigate the complex structural challenges associated with system transformation and health disparities. Today, I'm excited to welcome David Zuckerman to the Health System CXO podcast. David serves as president and founder of the Healthcare Anchor Network and has been leading the organization since its inception in 2017. Our team has long been a fan, along with many members of the Health Management Academy, of the industry-leading work at the Healthcare Anchor Network. And one of the things that I appreciate the most is how you've helped health system leaders really think concretely about how they can address community disinvestment and economic insecurity by intentionally leveraging place-based economic power. So it'll be a treat to talk with you more about that today. Dave, thrilled to have you on the podcast.
Thank you, Jasmine. It's really wonderful to be here with you.
Wonderful. So first, I'd love to hear you talk a little bit about the role that Healthcare Anchor Network plays in addressing health and economic inequities.
Yeah, so I want to just take a step back and share that when I first started this work more than a decade ago, and I was introduced to the idea of health systems as anchor institutions and what they can do for communities, I was just captivated from the first moment by the transformative potential of the strategies, yet the practical nature of them. And since then, I've really been working as a passionate advocate, to catalyze health systems to leverage individually and collectively their hiring, their purchasing, their investing, and really all of their assets to create more economically and racially equitable local economies that sustain healthy communities. And that's really at the heart of what the Healthcare Anchor Network is about. We see that health systems are incredible assets as an institution. And as I think you've talked about in some of your previous podcasts, they are the largest employers in almost every community across the country, sometimes the largest employer in their state. And in addition to their core mission of improving health care for the people they serve, they need to be at the table for other more important conversations around the overall thriving of the communities they're in. And that just so happens to align with how many healthcare systems are evolving their missions to recognize that those are the root causes of what impacts their ability to deliver both quality and affordable healthcare in their communities. And so it's just this wonderful, perfect fit. And about 8 years ago now, there were a number of health system leaders who came together and said, yeah, we need to think more thoughtfully about not just the community benefit we do, which is, a few percentage points of our overall resources. We need to think about what the other 95+% of our resources can do. And that just so happens to be our core business practices. And is there a way to leverage those assets more intentionally? And so we bring together health systems to ask that question, to learn together, to make commitments together, to really move this forward and build a movement within the healthcare sector for normalizing this way of doing business. And the 75+ members of the Healthcare Anchor Network today, they represent more than 1,000 hospitals, or almost 40% of nonprofit healthcare. They employ more than 2 million people, purchase more than 100 billion annually, and have more than 250 billion in investment assets. That's a tremendous amount of resources from just those 75 systems, which again is not even half of the nonprofit healthcare sector. And we're not about shifting every dollar of spend or changing how every person is hired or moving every investment dollar. But if we bring intentionality and an alignment perspective to just a small portion of those resources, I really believe that we can get at improving economic security, improving community health, and do that through intentionally targeting the communities with the greatest health disparities. And so that's just made me a passionate advocate for this work. And I think others have come into the fold, into the network, and have found that passion as well.
That's wonderful. Yeah, we've heard so much about your work at the Health Management Academy. We spend our time with many, many leading health systems. And so we think about that subset of organizations as health systems that have $2 billion or more in total operating revenue. And so obviously that provides such an opportunity to be an economic engine, to really be a stabilizing force in communities across the country. And so maybe we can transition. I'd love to hear you talk a little bit about why you see hiring, purchasing, and investing as the core pillars where you focus your work with health systems?
Yeah, it's a great question, and it comes back to the reality that at the root cause of poor health is economic insecurity, and
Mhm.
that's exacerbated by inequities, racial inequities in our society. But that economic insecurity we really need to address, and we need to address it for whoever has those disparities within the community your organization serves. And the best way to do that is not through another health program. Those are important. Those are important to help address the health needs that individuals have. But when we talk to communities, we hear time and time again that they're not necessarily thinking about that healthcare need. They're thinking about how can they put food on the table for their family. They're thinking about is the place they live in safe? Do they even have a place to live in? They're
Mhm.
thinking about how do they get to their job so they can have money to put food on the table. And those things are not necessarily going to be solved through another program that a health system can stand up. But they might be able to be addressed and chipped away at through leveraging the core business practices the hospital has. They hire a lot of people, they purchase a lot of goods and services, and they have an investment reserve that they need to keep growing in order to make sure that their business is sustainable. And all of those things can be leveraged in a different way in the course of doing business that is practical but can have an incredible social impact if we simply ask the question. But we have to ask the question. Like, we're making a decision around a workforce development program, how can we ask the question about is there a way this can align with the goals we have for the neighborhoods we know have the greatest health disparities? If we're making a decision around creating a new purchase service, and one that I think is a really powerful example of this is around laundry. There's
Mhm.
a couple of examples of this now. You know, we don't think about laundry as a way to improve people's health and well-being, but it very well can be. And laundry is a tough business. It's a tough business in the healthcare environment. There aren't a lot of really great providers, and healthcare systems really need their laundry to be done efficiently and cost effectively. And
Mhm.
they can't be thinking about that. It's such a fundamental part of their business, and we've seen now a couple of examples where this was not being done well from a business perspective. And in the course of saying, okay, can we create a new laundry provider that does meet our business needs? There was also the question asked around, can that create jobs in certain communities where we know we have high unemployment rates and we're serving those people? And can we make those jobs better than just frankly low quality entry level jobs that a laundry service might provide? Can we make sure they're at a decent living wage? Um, can we have a wealth building component? Can we think about tying this in with some other nonprofit in the area so there's an affordable housing development idea component of it? And can
Mhm.
we just think more broadly? Not We don't have to solve everything on our own. There are partners out there who want to help us, but can we ask that question and can we be at the table? And so the example I love to give is Evergreen Cooperative Laundry in Cleveland, Ohio. Started 10 plus years ago and now handles all of the laundry services for the Cleveland Clinic. It's not a charity, it's a business. But
Mhm.
in the course of building its business, it now does profit sharing of almost $10,000 a year for its employees that work in its laundry. And there's a new laundry that just opened in in Chicago that's modeled on that, called Fillmore Linen Services, and Rush University System for Health really helped be the catalyst for that project. Again, paying above living wage, really ensuring that the people hired are from the community, focused on profit sharing, and overall focused on good quality jobs, and recognizing that's such a fundamental part of how we can address people's health and ensure that they can live the thriving lives they want to live. Just lastly, on investment, I think this was something that one of your previous um, speakers talked about Mikkel more, and I'll just kind
Hmm.
of build on her comments. I get very excited about impact investment and what it can mean for the sector and addressing inequities within our community, because it really is such a small portion of the investment reserves that health systems have. We often talk about, can you start by just allocating 1% or even less than that, but just take the steps towards putting aside some money from your investment portfolio, still going to get you a financial return, but how can it help have a social or economic or impact in your community that is aligned with that financial return? Oftentimes, it's housing, capital for small and diverse businesses, maybe even childcare, and that tangible impact it has far exceeds the small concession that a health system takes on that very small portion of their portfolio. And happy to talk more about that.
I love that. I love the practical examples. One of the things that we've talked about a lot on this podcast is really putting concepts focused on equity in plain language and thinking about what are some of the tangible, concrete investments that health systems can make that really drive health and well-being in the communities that they serve. And even things like laundry, like you said, I mean, it may be something that a finance executive or folks who are sitting in operations, those may not be things that they've necessarily considered, but it could have such a tremendous impact in terms of what you're doing in partnership with the communities that you serve. So I think those are great to give folks some nuggets, some food for thought. Can you talk about where anchor mission strategies live within the health system?
Sure. So maybe just one addition to I appreciated the comment you just made. And I think sometimes the challenge of this work is that it is very concrete, it is very practical,
Hmm.
but it is very adaptive to your community. It's not one size fits all.
Hmm.
And it really requires you being at the table. And I think about when you boil the anchor mission down to its most basic tenets. It's how are you open to leveraging your resources differently? And then how are you at the table in your community to know what resource might need to be leveraged at what time?
Hmm.
And that's really what it's at. It's about not saying, oh, we've never done that, so we can't do that. And it's also not sitting back and saying, oh, well, what can we do around investment or hiring or purchasing, and not being connected to the tables within your community that can help you do those strategies most effectively and powerfully, and ensuring that you don't have to do everything on your own, that
Hmm.
you really are the thing as a health system that makes the initiative work. But there are so many players, whether it's government, nonprofits, philanthropy, other anchors that want to work alongside you and can bring so many other pieces of the puzzle and make it fit together and work. So how does this live within a health system? I think like any successful strategy, it has to have visibility from the top. If and sometimes folks say, well, we tried it and it didn't work. And well, I often say, well, did it have true executive sponsorship? Was the board aware of it? Was there someone supporting that executive sponsor? Were you actually creating the cross sector team that is needed to pull the different expertise? Right, if we're talking about a workforce development initiative, it probably should have someone from HR. It should probably have someone from community health. It maybe
Hmm.
needs someone from government relations. There's a variety of people that need to be pulled together to really bring the complete perspective. And I think that is true of any transformative initiative. What I think is powerful about this, though, is that compared to some of the other initiatives in a health system that cost a lot of resources, I think the ability to leverage a small amount of resources dedicated to anchor mission is it far exceeds other initiatives of a similar approach,
Hmm.
because a lot of this is stuff you're already doing, and it is about just bringing the right people together and creating just enough space and time to say, oh, yeah, we can do that. We can build that. And if we put this relatively small amount of resource into it, the gains will be really significant and spill out into the community in many different ways. And so we recommend, again, someone who really owns this as a senior executive lead, someone who supports them as an anchor mission project manager. And then over time, as you have the different strategies coming together, bringing together the necessary expertise from HR, supply chain, treasury, we see government relations as a part of this. We have increasingly been engaging those who do policy advocacy to recognize that this is, yes, about what you can do as a health system, but there are resources that the public sector needs to put into the ecosystem for these projects to work. And your voice goes a long way as the largest employer in your region, and
Hmm.
you should use it to advocate for things that are non-clinical. And we've been having a lot of success on that, specifically around housing and workforce development.
That's wonderful. That's wonderful. And I'm reflecting on a conversation that we had with finance executives at our fall Chief Financial Officer Forum for the Health Management Academy. And one of the things that came up is, how do we identify where some of those opportunities exist in the organization? And I think, to your point, the opportunities really can be everywhere, right? You can get a lot of bang for your buck in the everyday decisions that are being made, and the investments that are being made by the organization. And so identifying a place to start and then making sure that is a starting point and not an ending point, and really working dynamically with communities, I think is just such a good reminder.
And it's not that these all of these ideas that I'm talking about are something that a health systems have never done before, and some of them notably have done it, and that's where we help pull together these different ideas and say this is what a comprehensive approach looks like. But I think that's the shift we're seeing from this being one mission driven leader who is able to have a change in their part of the organization, to saying, well, what happens if you aligned all these things? Because it is a difficult financial time in healthcare, and we can't afford to be working at cross purposes. And I think creating that alignment of what are we trying to do around upstream, outside the institution, and connecting it through is really an important factor for having the impact we want to see and sustaining the work. And I guess the last thing I would say on this piece is that I think sometimes institutions are a little hesitant to bring this work to their board,
Hmm.
but my experience has been that they've been the most supportive because they're of the community and they're like, of course we should be doing that in the community. They come to the organization because of the organization's reputation within the community, and they want to see that continue in a really positive way. And so oftentimes, like impact investing, when we see it get brought to the board, they're saying, well, why don't we go further and faster on this than you guys are planning? We think this is a no-brainer.
That's wonderful. That's wonderful. So you mentioned, the kind of financial health of a lot of organizations and really recognizing the fact that this is a difficult time in healthcare. How do you all think about the business case for health systems to engage with the healthcare anchor network and implement the anchor mission?
Yeah, as I talk to health system leaders, when I hear about where their strategic plans are focused, they often say there's three key areas: employees, patients, and community. Sometimes they use a lot of alliteration, but really it's those three groups. And I can think of no better strategy that cuts across all three of those areas. And I'll give you some examples. Oftentimes, I think when you talk to leaders the first time about the anchor mission and these ideas, they say, oh, okay, that's community. We'll get to it when we have the time. But let's take housing. Almost every community is struggling with having a sufficient amount of affordable housing, workforce housing. That impacts your employees. We hear time and time again how nurses can't move to an area because they can't find housing. Some communities, it's even doctors. Your patients, in terms of their ability to afford healthcare, for them to have enough, resources to purchase healthy food and live a healthy lifestyle, they need to have affordable housing. And then, of course, your community obviously um, needs to have safe and affordable housing. So if you think about impact investing from the perspective of this isn't just for community, it is helping the broader ecosystem through making 1% of our portfolio available to local community development providers who can invest that in affordable housing. We can begin to address these shortages in each of our communities in a way that gets at ensuring that we're taking care of our employees, we're taking care of our patients, and we're taking care of our community. And so I come back to this around alignment. Anchor mission is about, economic security, economic opportunity, community health. These are all things that an organization can do in the course of its business every day. And I think what's most powerful about the anchor mission is that it's not about, again, finding resources for a new program that you have to stand up and sustain in perpetuity, or that you have to aggressively fundraise for. Yes, there are some projects within this framework that will require some resources to get started, but at the heart of what we're talking about is really things that sustain, right? You help start that laundry, it's a viable business. You create that workforce development program and bring together the right partners, and leverage federal workforce dollars, or an apprenticeship program. You're helping reduce turnover in your organization and minimize that cost. With the investment piece, by our estimates, allocating 1% of your portfolio might reduce your overall returns by a cumulative 1% over 15 years. Very, very small amount. And yet in that time period, we've seen a sliver of that 1% catalyze hundreds and hundreds of units of production. One example that I really find profound is Dartmouth Health, and how they work together with other local employers in a very rural part of New Hampshire to stand up a loan fund, put an investment in of $3 million, and they're on the path with those other partners. It leveraged another 7, and then they're on the path to creating 300 units of housing in rural New Hampshire. That's incredible. And it's going to be at a level that it will benefit their employees and their community alike. So I think there's a lot to be said here around the, doing the right thing is often a good business decision. We haven't seen anybody doing these strategies who have said, oh, we really regret it. And oftentimes for the leaders that get involved, the executive leaders who are new to it, they often say this becomes the favorite part of their job.
Yeah. It's really striking how much it can be a virtuous cycle, I think, internally within the organization, but also as you think about the ways that those effects in the community can compound on each other. You're building viable businesses in the community, or you're really thinking about the way that you're improving someone's economic, positioning. I think that's something that just continues to yield positive outcomes year over year. Well, last question.
Agree more.
Yeah, last question. We're recording this in January, so we're heading into a new presidential administration this year. What are you keeping an eye on for your work at the Healthcare Anchor Network?
Yeah, that's a great question. And so I think what I shared earlier was that the nice thing about this work is that it is local by nature. And it is about how an institution, as a critical economic engine, is leveraging its resources more intentionally. And I think that can continue, and that should continue, and that may even be needed more than ever in the years to come. And we may see more things be done at the local level. But I do think there's a policy component to this. And one of the areas that we have been focused on with our health system partners for the last 5 years is helping them understand that they can do a lot around workforce development and affordable housing, but there are federal resource streams that really help make that work easier for them. And they should be helping to protect and expand and advocate for them. And I think that advocacy and that voice is going to be more important than ever to help policymakers understand that this work is about economic security, it is about economic opportunity, it is about economic development, and that they as health systems can be a critical partner in that, if at least a certain amount of resources is available for them to leverage with their own resources. They're bringing their own resources to the table, and they want to continue to do that, but some of those resources need to be available at the federal level, and we need to protect those resources that exist, specifically around workforce development affordable housing, as well as other programs that are important for ensuring people can live healthy and thriving lives. But that will be our piece of the puzzle, specifically those two areas. And I think the other piece is then, what are the opportunities at the state level in certain communities where health systems can continue to make that case, bring more resources, help educate their policymakers about how they can be a leverageable asset in their communities. We saw Maryland for the first time allocate some resources specifically for anchor institutions to do community economic development. That's a really wonderful example. How can those continue to be replicated across the country so we can build on the work we already have done and can continue to do.
Wonderful, wonderful. Well, I'm excited to watch, and we'll have to have you back for some updates to see how things pan out over the next few years. David, thank you so much for your leadership, for sharing your insights with our audience, and we'll see everybody next time on the Health System CXO podcast.
It's been my pleasure. Thank you so much for the invitation.
Thank you for joining me on the Health System CXO podcast, where we activate health system leaders towards outcomes and scalable solutions you can implement now. Remember to subscribe to the Health System CXO podcast on your favorite podcast platform so you never miss an opportunity for insights. If you like this episode, consider leaving us a review and sharing our podcast with your friends and colleagues. You can also connect with us on LinkedIn by clicking the link in the episode description. See you next time.